thank you for the introduction and for letting me be part of this great Aspetar Hamstring online forum, Rod. And hi to you all in Doha and the rest of the world from Oslo. I'm currently working here in Oslo as a physiotherapist at NIMI, which is the Norwegian Sports Medicine Institute. And I'm seeing quite a few patients with different types of hamstring injuries, and also I'm involved with some ACL and hip-related research projects. So I'm looking forward to take part of this online forum. So in my talk today, I've been asked to talk about the prognostic role of MRI findings. Following a hamstring injury, our role as clinicians is to guide the athletes through the return to sport process, starting with establishing a diagnosis based on commonly clinical examinations and supplemented by radiological imaging if needed. And then trying to give a prognosis for time to return to sport before we continuing the rehabilitation and return to sport process. But one of the really challenging part is the process related to the prognosis. And the use of MRI following hamstring injuries has been frequently debated the last decades. And this talk is not about whether we are to do MRI or not. I guess we all acknowledge that in many cases it has its important role as a supplemental tool in the diagnostic approach, especially to rule out more severe pathology such as free tendon avulsions and ruptures. And also in elite sports where the external pressure is high in returning the athlete as soon as possible, MRI may be performed not only for medical reasons, but also to give medical staff some leverage to keep the athlete sidelined if needed. However, using MRI findings to quick and accurately predict return to sport seems to be a major challenge. So the aim of this talk is to discuss and maybe answer these two questions. How valuable are MRI findings for prognosis? And how do we communicate these MRI findings to our athletes or our patients? So to answer this first question, if we look into the evidence for prognostic factors for return to sport, there has been quite a few studies that have looked at MRI findings as prognostic factors for return to sport. And in 2014, a systematic review systemized and reviewed the current evidence where they concluded based on the findings that the quality of the studies were quite low. There was a high risk of bias and lack of multivariate analysis. And in particular, they criticized the lack of blinding for the return to sport outcome. There were no strong evidence for any MRI finding, but they found that there were moderate evidence for MRI negative injury, which was then associated with reduced time to return to sport. And there was moderate evidence for that proximal free tendon injuries was associated with longer time to return to sport. After this review, several studies have been published, generally with a high quality, but many of them are based on the same data sets from a limited number of research groups. So the topic is still controversial and debated, but I will present some of the studies recently published related to this topic later in this talk. But first, let's just highlight the importance of blinding when doing prognostic studies. So the outcome measure should be independent of the prognostic factor of interest to prevent biased results, which means in this case that the return to decision maker is aware and blinded to the potential prognostic factors, such as the baseline MRI results. Simply to avoid this scenario, that you treat the image rather than the patient in front of you. So this figure here quite nicely illustrates the challenge with making a precise return to sport prediction. If we look at the larger prospective studies, we can say that the mean time to return to sport for all injuries are approximately 23 days, with a standard deviation of approximately 10 days. So if you look at the figure 1a here, in a normal distributed data set where 95% of all the data will fall within 1.96 standard deviations of the mean. And if we then have a return to sport of 23 days and a standard deviations of 10 days, there is 95% chance that the return to sport duration for an individual athlete lies between 3 and 43 days. And this is not a very accurate estimate. So of course, this is just a group estimate, and preferably it would be ideal to narrow it down and reduce the standard deviations for the individual athletes by using tools where we can divide into smaller subgroups. And then maybe be able to make a more precise prognosis. So this would preferably be ideal both to differentiate between the return to sport for different subgroups and also for the individual athletes. And imaging findings and grading and classifications based on MRI findings have been proposed for this purpose. However, how valuable are these MRI findings for this purpose? And I will now go through some of the studies showing that the evidence is actually quite limited. So this is a study where we investigated the predictive value of clinical examinations only, and then the additional value of MRI. So in the figure here to the left, you see a regression model for 180 patients where we used prognostic factors or only clinical factors. And on the x-axis here, you see the actual number of days from injury until return to sport. And on the y-axis, you see the predicted number of days to return to sport. The dotted line is the perfect fit. So if all the actual number of days and the predicted number of days were similar, but you see the red line here, which is the regression line, and the gray lines, which are the confidence intervals, they are really wide. And this model only explained 29% of the total variance in return to sport. So that means that you can tell the athlete based on this model that you can return within 1 to 51 days, which is not very accurate. But then in the second model where we added MRI findings, we could only increase the prediction with 2.8%. So only 31.8% of the total variance was explained by this model. And now we could only narrow it down to 1 to 50 days, in which we concluded by this study that there were no additional predictive value of MRI compared to clinical examinations only. If we look at another study, this is the UEFA Elite Club Injury Study, one of the largest prospective studies to date, where they found that radiological grade correlates with return to play for grade 1 and grade 2 injuries. However, they found that the size of the edema only showed weak correlations with time to return to play, and there were no correlation with anatomical location and return to play. And if you look at the figures here for the grade 1 and grade 2 injuries, there's large individual variations and also overlap between the categories. And we should also be aware with using univariate analysis when looking at prognostic factors. If we look at the mean layoff times and the standard deviations in this study, the overall was 20 days for all injuries with the standard deviations of 15 days. For grade 1 injuries, the standard deviation was 15 days, and grade 2, it was 13 days. So here the standard deviations were quite wide and reflecting the challenge with making a precise prognosis based on MRI grading systems. Then in another study, we wanted to investigate newer grading and classification systems suggested in the literature. So here you see the distribution of return to sport on the y-axis, and then the modified patron severity grading system, which is a simple grading system based on the severity of the injury on the y-axis. The box plots shows then the median time to return to sport for each of the grading classification or categories. Here you see the same box plot, but for the British Athletic Muscle Injury Classification System, which not only using a grading system based on the severity, but also based on the anatomical location of the injury. And as you can see, for some of the categories here, we had quite a few injuries within the categories. The last system that we investigated was the Chan classification system, which is also a combination of grading severities and anatomical location systems. And here there are more categories, and as you can see, there are quite a few of the categories that had really few injuries within each of the categories. And you also see a large overlap between the categories. So the total variance explained for the MRI injuries in these classification systems were only between 7 and 12%. And what we found here was that there were few injuries within many of the categories, which made it harder to do sophisticated analysis and to do multivariate analysis. We found large variance within the categories and also a great overlap between the categories. So in conclusion, from this study, it was that MRI classifications cannot be used alone to predict time to return to sport. But then what about the intramuscular tendon? So the intramuscular tendon injury has been defined in by different authors. Anne van der Made, for example, has defined the intramuscular tendon injury as the section of the tendon that extends along and into the muscle, thereby having muscle fibers attached to it. And it's difficult to discriminate on clinical examinations where there is an injury to the intramuscular tendon and not. So in the literature, there has been some studies that has suggested that these intramuscular tendon injuries may take longer time than other injuries where the intramuscular tendon is not involved. If we look at the evidence, there are 2 retrospective studies and 4 prospective studies that have looked into the prognostic factor of the intramuscular tendon and return to sport. And I will just highlight this study by van der Made in 2017, where you see the scatter plot on the screen here, showing the time to return to play on the y-axis, and then in figure A, the presence of intramuscular tendon disruptions and also the severity of the disruption, and in figure B, the presence of waviness or not. And in this study, they found that full thickness disruption of the intramuscular tendon and waviness was associated with a longer time to return to sport. However, it was slightly more than a week longer. For partial thickness and longitudinal intramuscular tendon disruptions, there were no significantly association with return to sport, and they found a considerable overlap between the groups with and without intramuscular tendon disruption, in which they concluded that the clinical significance of intramuscular tendon involvement for the individual athlete is limited. So the question then, back to this figure, is can we make a precise return to sport prediction? Well, based on the current evidence, it seems that we're not able to make a precise return to sport prediction based on MRI findings. And it seems difficult to this date to narrow the standard deviations and narrow it down to a more precise return to sport prediction. Probably it reflects that there are so many factors involved in the process, and that might influence the time to return to sport, which might have a greater value and than the MRI findings at the time of injury. Regarding MRI classification systems, there are currently no studies that have targeted rehabilitation to the defined MRI categories. And we don't know if that might be beneficial, but I just want to show you a new idea from the British Athletics Muscle Injury Group, where they suggest to inform or to use the MRI classification system as specific guidelines for the rehabilitation process. So this is only a suggestion and a review, but it hasn't been shown in any clinical study whether it's effective or not. It's in elite athletics cohort, and we don't know if it's appropriate for athletes in different sports or with lower tendon or muscle tendon unit demand. So further work here is needed, and preferably in larger prospective clinical studies. So then how do we communicate MRI findings to our patients and our athletes? Of course, this is what every athlete wants to know when the injury happens. How severe is the injury? And when can I return? And of course, you can choose to use the mean values, which is probably 3 weeks if you have a grade 1 injury. And you can tell the athlete you'll be back in 3 weeks. However, you will then maybe have this scenario where you have a player or you have 2 players, where player 1 has a grade injury and player 2 also has a grade 1 injury. However, for player 1, the actual time to return to play is 14 days. And for player 2, the actual time to return to play is 40 days. So if you then tell player 1 to return within 3 weeks, and he could actually have returned 1 week earlier, he might miss an important game. If you tell player 2 to return within 3 weeks, and he probably would have needed more time, he might have an increased risk of re-injury, for example, or he might not progress as optimal as you would prefer. So we recommend not to give mean values and not to give a precise estimate, because we see that that is really hard to do. But what do we tell the athletes? So based on the evidence, we can say that the prognosis is based on the clinical reasoning process to which the MRI findings may contribute. However, we cannot use the MRI findings alone to give you an accurate prognosis. And there are large individual variations between each athlete and just after injury. So we can only give you some rough estimates. So for example, if it's a negative MRI, you'll probably have a good prognosis and a quite quick time to return to sport. If it's a subtotal or a complete avulsion injury, this will probably take you several months. If it's a grade 1 or grade 2 injury, it's really difficult to give you a precise estimate just after your injury. You will probably return between 1 and 50 days. And if your tendon is involved, it may take a bit of time, but it doesn't necessarily have to do so. It may also depend on your sport and your high-speed running demands. So finally, what we would urge the athletes to focus on is that an MRI is just a screenshot after injury, and there may be many factors that can influence your return to sport duration. So we would urge you to focus on your daily progression and your goals throughout the return to sport process, which will lead you to the return to sport and your return to performance. And with that, I just want to thank you for the attention.